Meantime, Maine has reported its first measles case since 2019. The state CDC says the patient is an adult from Penobscot County.
And with more than 700 cases reported now across the country just this year, we wanted to learn more about the risk here in Maine and how you can stay safe. Ronnie Perlow spoke with a health expert today on the steps you can take and also how hospitals are preparing. So, Ronnie, what more can you tell us? A lot to talk about here.
Yeah, John, it's been almost 7 years since a measles case was reported here in Maine. Health officials say the person in Penobscot County brought measles back from out of state. Now, because the viral disease is so contagious, we wanted to know if Maine is ready for a possible increase in cases.
You have to start assuming that you're likely to be exposed at some point in time.
Dr. Dora Mills says while there's no need to panic, a reported measles case in Maine should make everyone pause and plan ahead.
One thing that everybody can do is to check their vaccination status. Everybody should have had 2 doses, but again, if you were born before 1990 or so, you might have just had 1 or had an earlier version or not at all.
You can check your vaccination status by talking to your primary care doctor or getting a blood test. Maine has one of the highest measles, mumps, and rubella, or MMR, vaccination rates in the country among children, who can be among the highest risk for measles. You can see the symptoms there on your screen: a fever, cough, runny nose, watery eyes, and a rash that starts at the head. Mills says one person can infect 90% of the people around them if they're not immune or unvaccinated.
If you are exposed at all, which doesn't even mean you have to be in the same room, you can be in the same building with the same ventilation system, and that's considered being exposed to somebody with measles.
She also says there's concern about stress on the healthcare system in Maine, as states like South Carolina are becoming overwhelmed.
We're always ready to address whatever public health emergency that comes our way, but we are still in the throngs of a very severe flu season too. So hopefully we can get on top of the measles as well.
Now, Mills says there are people who are not candidates for a measles vaccine, like pregnant women and people who are immunocompromised. Now, I also reached out to Portland and Lewiston public schools today to ask about their plans for handling a possible outbreak. Portland superintendent told me all students must have an MMR vaccine unless they have a medical exemption that's submitted by a doctor. Maine does not allow religious exemptions for vaccines for public school students. In studio, I'm Ronnie Perlow for Maine's Total Coverage.